Yeah, we are live.
Right? I cannot see myself.
You just start.
Okay. A very good afternoon to all. On behalf of Vivekanand Education Society's College of Pharmacy, I, Dr. Aparna Darshan Palshetkar, Assistant Professor at VES College of Pharmacy, feel privileged to welcome all the dignitaries, Shri B.L. Bulani ji, Dr. Anuradha Majumdar, Dean, Faculty of Science and Technology, University of Mumbai, Dr. Jayashri Fadnis, Vice President, Vigyan Bharati, Dr. Prabhakar Dongre, Professor and Head, Department of Biophysics, University of Mumbai. Our keynote speaker for today, Dr. Vandana Patravale, Professor of Pharmaceutics, ICT, Mumbai. I welcome our Principal Madam, Professor of Pharmaceutics, Dr. Supriya Shidhaye, and all the delegates for celebrating AZADIKA AMRUT MAHOTSAV. Before we initiate with today's session, we are very happy to share that we have received registration across the nation. Moving to our session, Institute's Innovation Cell of WESCO under the aegis of University of Mumbai in collaboration with Vidnyan Bharati, KONKAN PRANT and Department of Biophysics, University of Mumbai brings to you lecture series. We are indeed fortunate that we have Dr. Anuradha Majumdar Madam with us on this precious occasion. Dr. Anuradha Majumdar, Dean of Faculty of Science and Technology, University of Mumbai, had more than 24 years of experience as an academician and scientist. Currently, she is leading the newly established Center of Excellence in Maritime Studies, CEMAS, established in the Kalina campus of University of Mumbai in the capacity of in-charge director. Madam's area of specialization is pharmacology. She has successfully completed a significant number of government-sponsored projects, including AICTE, BRNS, DAE, DBT, BIRAC, DBT, UGC, Major, etc. She is a consultant to pharmaceutical and allied industries and has completed several industry-sponsored projects. Recently, her proof of concept on a drug delivery system platform has been selected by Cipla Limited in its Innovatia drive and taken up by the company for further development. She has taken up the mantle of Dean Science and Technology since more than 2 years and has worked relentlessly towards upward benchmarking of academics and research at the University of Mumbai. I would like to request Dr. Anuradha Majumdar, Madam, to present introductory speech on this occasion.
Thank you, Aparna ma'am, for your kind introduction. Namaskar to all. First of all, congratulations to Vivekanand Education Society's College of Pharmacy for organizing this event commemorating a proud year for all Indians. That is the 75th year since independence, Azadika Amrut Mahotsav. And that too on such an interesting topic, which sort of draws a trajectory and creates a landscape understanding of the entire collage of the Indian pharmaceutical research, reliving the history, drawing the pattern of what kind of research, how we have reached a stage where India is creating a dent not only in the Indian pharmaceutical scenario and domain, but also in the global scene and marching towards Atma Nirbhar Bharat. Bulani ji, sir, a revered person for us. Namaste. And thank you for giving me an opportunity to be part of the same session where you are part of. It is indeed a privileged moment for me. Dr. Supriya Shidhaye, Chairman, Board of Studies, Pharmacy, and a dear colleague, and I can also add a friend, who took the lead when the discussion started on that we should have a series of events under Azadika Amrut Mahotsav, commemorating this important landmark year, creating the sense of belongingness amongst us, amongst the students, the pride in being citizens of India, understanding the commitment and the strive which has gone into creating this nation after 7.5 decades where we stand. And that was very important. And Supriya Madam took a lead, and she was the one. We had an event yesterday. She was the one who sort of helped curate a series of events which was taken up by various lead pharmacy colleges, and we are seeing this as a culmination of the same. And the best part is that it is also in collaboration with University of Mumbai, and the Department of Biophysics and VIJNANA Bharati Konkan Prant. So, Supriya Madam, thank you very much, not only for this event, taking a lead role, but also taking a lead role in curating and steering all the series of events, which is going to be conducted as a series by pharmacy colleges. What we wanted is that students, we discussed that students should feel proud of this milestone year. And not only that, they are going to shoulder the demographic young are going to shoulder the responsibility of further opening vistas and further broadening and bolstering India's name in the pharmaceutical and healthcare arena. And this was a very important year for us and for them. So thank you, ma'am. My colleague, Dr. Prabhakar Dongre, sir, head of the Department of Biophysics. Let me tell you, a very apt department to collaborate with. Dr. Dongre very recently got registered his the startup company Sinova Limited, and I can tell you the kind of research which is going on in Dongre sir's laboratory. He's sort of he's a one-man army of Department of Biophysics. We also have a gamma radiation center there, along with, you'll not believe it, Dongre sir has tweaked many of the standard equipments given by multinational vendors to suit his type of samples which is being tested. For example, it was meant for solid chemicals, and it was converted to liquid form. So imagine, that is what innovation is all about. You need not reinvent the wheel. You need to innovate and improvise products and processes. And that's what his lab does. Lot of technologies developed, many of them meant for even training for undergraduate and postgraduate students. Dr. Jayashree Fadnis Madam, Vidnyan Bharati, I am probably meeting you for the first time in this virtual platform. Konkan Prant, I'm sure in the long run we would like to associate with your organization and make this AZADIKA AMRUT MAHOTSAV in all verticals and domains an important year which is commemorated in the right spirit, with the right this of Desh Bhakti being inculcated and being part of our subconscious mind. And that's very important. Our today's speaker, such an eminent person, Professor Dr. Vandana Patravale. I have known Madam for several years. In fact, Madam has been a role model for me. And considering that, we are talking about today marching towards Atma Nirbhar Bharat and the role of academic innovation and translation and transformation into use in mankind, I think she's the best resource person who can be there with us, with 20 plus patents granted, 20 plus patents in the pipeline, more than 20 tech transfers being done by Madam and her team. I think she exemplifies academic innovation, generation of patents and IPR by academic institutions and academicians and scientists, and also its transformation and translation to mankind and use for the betterment, especially in unmet areas. All the faculty who have joined us from VES and other institutions, students who have joined us today, you all are an important part in this event. I feel COVID-19, although on one side it has been a disruptive change, unprecedented event. We know the earlier pandemic was in the earlier part of the 20th century, and that we are seeing one more pandemic after more than 100 years. So it was no doubt unprecedented, but it also opened up new areas and vistas for us. One such disruptive change was online education, and as just now Vandana Madam was mentioning in our candid chat, that this probably, the education per se, now with this online platform, with all its pluses and minuses, has made outreach, both plus harnessing of talent, borderless and seamless. We can harness and leverage on the best of faculty across India and globe. Plus, we can outreach to students. And today, anyways, as you know, government and UGC is promoting use of online education and permitting it up to 30%. We have Swayam, NPTEL, several platforms which are offering courses in the online mode. And I think this is something which is going to be in the reckoning in the future. So even if there are courses which are offline per se, but maybe 30% we can go online in its delivery. And with new education policy, many of these would also, we would get opportunities to have courses and programs in the distant and the online mode as well. When COVID came 2020 March, with the clarion call of Honorable Prime Minister Shri Modi, you remember at the early part we were sort of perplexed, did not know how this was going to pan out. But then we saw that you must have seen how much proposals BIRAC gave, the kind of funding. Atma Nirbhar Bharat, that concept that we should be self sufficient, especially in the with respect to essential commodities, was what was driven into us when we saw that there were some shortfalls in ventilators, PPEs, essential vaccines, and medicaments. But later on, as you know, India geared up. We had our own set of vaccines being developed indigenously, and which worked. We not only catered to the Indian citizens, we also exported. Indian government gave it for free to many countries, and we have done a great social responsibility, which included giving vaccines and PPE kits and other allied products to the rest of the world from India, when there was a total global scarcity and countries were facing grave this during the Delta and the earlier COVID phase. So this is very important. I think that we have to become self-sufficient, and Atmanirbhar Bharat is also part of sustainable goals of India, whether it is food, agri, whether it is healthcare, whether it is other sectors of essential commodities. The more we are self-sufficient, the better we are equipped to face any unprecedented challenges, maybe in the with natural calamities or any other calamities which we saw in the form of COVID. So I would like to also say that probably the triad of Atmanirbhar Bharat, Make in India, which was again a very important initiative started by this government during its first tenure, and New Education Policy 2020, together is going to help us achieve Atmanirbhar Bharat stature, and also probably gear us to adopt and to execute Education 4.0. Here we mentioned education, pharma education 4.0, catering to the industry 4.0, and whatever is required for the new technologies of the cusp between physical systems and cyber systems, use of IoT, artificial intelligence, etc. In fact, Dr. Supriya Shidhe, madam, along with her team, are designing special value added electives for our students, because in the future this will be parallelly required in a typical industry 4.0 a pharma company. And so our students should be equipped to know the basics so that they do not falter or get challenged by engineers or other professionals. So our students would have holistic knowledge and a sound foundation to build on during their careers through in-house training, additional courses being garnered by them, etc. And I believe that will help us achieve the goal. As Dr. Vandana will speak to you and you'll realize it, the Global Innovation Index, since the last declaration, India is at 48th amongst 130 global economies. So if you see the top economies like Switzerland and USA, there's a large impact and large contribution of academic innovation in the country's innovation index. And the innovation index need not just be patents being translated to products and adding to the ranking of the country, but also can be basic research which gets cited in patents, which has impact in creating innovative products and processes. So I request my dear students and faculty and scientists that we also, from because if you see the kind of contribution and the analysis being done, it's that most of the contributions are coming from central universities, IITs and ICERs. Why not public universities like us? Why not affiliated colleges? We are having the best of faculty and scientists and the one of best of students. So it's important to understand that if you are finding process and products which you feel has merit of innovation and novelty, then you should file a patent, an Indian patent first, and see if it's possible to file an PCT. If not, collaborate with an industry within 1.5 years and file a PCT and translate your idea, your product, your prototype into commercial production and application. And that will actually help us pitch India in the global innovation index, notches higher in all the global economies which compete for this ranking. So, with this, I request my students, my dear students, this is a very important year, 75th year, Azadika Amrit Mahotsav. We are lucky to be part of this year. And I request you to pledge that we all would respect and salute the contributors, compounders, pharmacists, healthcare practitioners, allied workers, paramedics, who have contributed to Indian healthcare system, pharmaceuticals, traditional systems of medicine, including Ayurveda, Siddha, Unani, and also practitioners of homeopathy, and salute them for their contributions to where we stand today. And remember, you are our future citizens, future not only Indian citizens but global citizens. Even if you stay in India, you are going to make a mark globally through your company and through your behavior and being ambassadors of India. So I request you to shoulder the responsibility and let us embrace and adopt to the education 4.0 and implement it in industry 4.0 and adapt to whatever changes science and technology throws at us and make the best of it and bring laurels to our country, our society, our institution. All the very best. Thank you, Bulani sir and Supriya madam, for giving me an opportunity to be here with you all and wishing this event the very best.
Thank you, madam, for that wonderful welcome remarks. It has created a right platform for this event. Today's event is in collaboration with Vidnyan Bharati. Vidnyan Bharati, popularly known as Vibha, is a Swadeshi science movement working for the popularization of science, implementation of modern technology, and blending it with the rich scientific wisdom of India. Vidnyan Bharati is a
It's not audible on here. Okay. Sorry.
Okay. I would request Dr. Jayashree Fadnis Madam, Vice President of Vidnyan Bharati, KONKAN PRANT, former principal of VES Arts, Science, Commerce, and microbiologist by profession, to introduce Vidnyan Bharati to the audience and enlighten them with its objective. Over to you, Madam.
Thank you, Dr. Aparna, for the kind introduction and giving a brief about Vidnyan Bharati. A very good afternoon to all. Namaskar. Shri B.L. Bulani ji, the Managing Trustee of VES College of Pharmacy, Principal Dr. Supriya Shidhe, Convener and members of the Innovation Cell at WestCorp, our esteemed speaker for today, Professor Vandana Patravale, MyCT Mumbai, Dr. Anuradha Muzumdar, Dean, Faculty of Science and Technology, University of Mumbai, Dr. Prabhakar Dongre, Professor and Head of Department of Biophysics, University of Mumbai, Professor Srinivas Samant, President, Vidnyan Bharati, Konkan Prant, all the members of Vidnyan Bharati as well as the Governing Council members of Vidnyan Bharati, all invitees, faculty members, and dear students. Well, we have just heard the address given by Dr. Anuradha Muzumdar, the Dean, Faculty of Science and Technology, University of Mumbai. Thank you, Dr. Muzumdar, for setting the tone for this session. At the outset, I extend my gratitude to Principal Shidhe for collaborating with Vidnyan Bharati as well as the Department of Biophysics, University of Mumbai, to conduct today's program for celebrating AZADIKA AMRUT MAHOTSAV. I appreciate the efforts of the Innovation Cell at WestCorp for coordinating this event and collaborating further with a cluster of pharmacy colleges, thereby extending this platform to a larger number of students and faculty members. Vidnyan Bharati, popularly also called as Vibha, was established in 1991. Besides the national central body, Vibha conducts its activities through the 36 units established across the country. The basic objective being the popularization of science and creating awareness about its significance amongst all cross sections of the society. Vidnyan Bharati has several flagship events like the Ahar Kranti, Vidyarthi Vigyan Manthan, a talent search examination held for the school children, the standards 6th to 11th, conduct of the Indian International Science Festival, and creating awareness on contemporary issues. As the nation looks forward towards celebrating the 75th Independence Year, Vidnyan Bharati envisages to have a unique year-long celebration under the banner Swatantrata Ka Amrut Mahotsav by bringing forth the contribution of Indian scientists towards the freedom struggle. When we talk of freedom struggle, we may be reminded of several freedom fighters: Mahatma Gandhi ji, Netaji Subhash Chandra Bose, Lala Lajpat Rai, Bal Gangadhar Tilak, Bipin Chandra Pal, Savarkar, many, many more. Seldom do we relate the contribution of our scientists during the freedom struggle, and therefore the theme of Swatantrata Ka Amrut Mahotsav is to build a narrative about the contribution of our scientists towards the freedom struggle, pay our tributes to these intellectual warriors who laid the foundation of science in our country, understand the significance of science as a tool for national growth and learning from their experiences, understand science diplomacy used in the pre-independence era and its dire need now to help India become a superpower, arousing national pride as we celebrate our 75th independence year. Well, to understand the struggle faced by our scientists in the pre-independence era, we need to visit history. After the War of Plassey in 1757, Bengal was captured and the British made inroads via establishing the East India Company in 1760. They found India to be vast, rich in natural resources, having very skilled artisans, brilliant scientists, and it was felt that it is a land of abundance. Our ancient civilizations are centers for learning, like the Nalanda and the Takshashila universities, and many other institutions have been destroyed through various invasions faced by our country even before the British invaded us. Well, the British invasion was distinctly different, wherein the British tried to tap our own resources in a very systematic manner using science and technology as the most powerful tool. They used science to bring about a change in our economy, education system, and the social fabric at large, thereby establishing their supremacy over us. All this was done to utilize the resources here in India to support the industrial revolution in Britain. Money was siphoned in huge amounts to foster the industrial revolution. Gradually, after gaining control, started the mind game of making Indians feel inferior, defacing Indians as uncivilized, irrational, and completely immersed in a pool of superstitions. Thus, the tag of inferiority was put on our natives. Our meritorious scientists were deprived of opportunities, recognition, and the due positions in the institutes of higher learning and research. Our scientists have suffered a lot, and to retaliate this racial discrimination, they felt the dire need to become self reliant by adopting various methods. The most important and significant being the laying foundation of indigenous institutions in our country. The first to start such an organization was Mahendra Lal Sarkar, where through immense efforts he established the Indian Association for Creation of Science in 1876, and that provided a great opportunity, a platform for Indian scientists to do their work. In fact, Dr. C.V. Raman, he carried out a large portion of his work in this institute, and later, all of you are aware, he got the Nobel Prize. Many other institutes, such as the Institute of Science, Bangalore, was established in 1908. Jamshedji Tata was motivated by Swami Vivekanand and Sister Nivedita to start this institution. Thus, the Calcutta University College of Science was established by Ashutosh Mukherjee in 1914. The Indian Chemical Society was established in 1924 by P.C. Ray. The Basu Vigyan Mandir was established in 1917 by Jagdish Chandra Bose, and the Indian Academy of Sciences was established in 1934 by Dr. C.V. Raman. Well, the list is long, and it's not so easy just as I read these names. It required determination, financial support, and was accomplished in a phased manner. It was rather a struggle to establish these institutions. Another important aspect was initiation of industrial manufacturing units in our country, providing scope for employment and also becoming self-reliant. P.C. Ray started the Bengal Chemicals in 1901, and many such industries, the Bengal potteries, the enamel works, the salt manufacturing, and many more. J.N. Tata took the initiative of establishing the Tata Iron and Steel Works at Jamshedpur. And this happened because P.N. Bose, a very reputed geologist, could guide Tata in giving him information of the ores that were present. That area, that region was rich in mineral ores, which was a raw material to start such an industry. Thus, our visionary scientists adopted various other means for popularizing science besides establishing industries, besides establishing indigenous research institutes. They contributed in a big way for popularizing science by conducting exemplary lectures, writing books, and created a platform for publishing research work through journals and through various other avenues, which became then a boost for the other scientists too. To understand the contribution of these scientists, it is essential to go through the history of science, read their biographies, go through the articles that describe their work and their national fervor, which will enlighten us to appreciate the immense role played by scientists during India's freedom struggle. Well, therefore, Vidnyan Bharati planned to celebrate the 75th year of independence as Swatantrata Ka Amrut Mahotsav. To understand the freedom struggle was through Swatantrata, through science, and an opportunity to remember the contribution of Indian scientists towards the freedom struggle. Vidnyan Bharati therefore proposes to celebrate Swatantrata Ka Amrut Mahotsav by reaching out to all cross sections of the society, the faculty members, the students, researchers, professionals, and masses at large. Various programs have been planned, such as talks of eminent speakers, conduct of various competitions, such as the essay writing, poster making, quiz elocutions, and many other innovative programs. To conclude, I once again thank Principal Supriya Shidhe and members of the Innovation Cell to give an opportunity to Vidnyan Bharati to put forth the objectives of Swatantrata Ka Amrut Mahotsav to reach out to the students, faculty members, and all the invitees. Thank you so much for a patient hearing. Well, we are all looking forward to the keynote address, which will be delivered by Professor Vandana Patravale on the topic Indian Pharmaceutical Research, Reliving History and Marching Towards Becoming Atma Nirbhar Bharat. I'm sure you will be inspired by Madam's talk to do science, live science, and contribute through science to make our country self-reliant. It's Atma Nirbhar. Each one of us owes a lot to our country. We need to take pride and responsibility in taking our country to greater heights. Thank you so much for giving me the opportunity to present these thoughts.
Thank you, madam, for that informative speech. Now, I feel privileged to introduce Dr. Supriya Shidhe, madam, Principal, Vivekanand Education Society, College of Pharmacy, on this occasion. Madam is a chairperson of Board of Studies, University of Mumbai. She has over 29 years of teaching and research experience. With her vast experience in research and academics, she has always guided and enlightened us. She is a lady who believes to lead by her own example. She has received total research grant of around 1 crore 25 lakhs rupees from various government bodies and pharmaceutical companies till date. She has many national and international publications and presentations to her credit. In this COVID era, we are constantly moving ahead and trying to adapt and evolve under her superb and strong guidance and constant motivation. I request Madam to introduce VESCO, Vivekanand Education Society's College of Pharmacy, to the audience.
Thank you, Dr. Aparna, for your kind words. Respected dignitaries on the dais, the august gathering of students and faculty members. On behalf of VES College of Pharmacy, I welcome all of you to this webinar. At the outset, I thank Dean Dr. Anuradha Majumdar for giving us opportunity to organize this event to commemorate 75th anniversary of independence of India. Dean Madam is very dynamic and deeply concerned for the growth of pharmacy profession. With her vision and research bent of mind, Faculty of Science and Technology has witnessed many reforms and launching of innovative programs at University of Mumbai level. I am grateful to Dr. Fadnis to give us the platform of VIJNANA Bharati to celebrate this moment of pride. Today's resource person, Dr. Vandana Patravale Madam, has created a number of national and international records in her every endeavor, may it be her patents or publications, citations or awards, number of researchers guided for masters or PhD or industry consultancies. We are really privileged to have her as our resource person, and I am especially grateful to Vidnyan Bharati KONKAN PRANT to connect us with her for this talk of today's event. Professor Prabhakar Dongre, head of the Department of Physics, University of Mumbai, has been very approachable and cooperative while collaborating this event, and I express my gratitude to him for the same. A few words about my parent institution, VES College of Pharmacy. VESCOP is managed by VES, the trust with more than 60 years of existence in higher education, while maintaining the legacy of producing quality education from KG to PhD. VES also offers UG and PG programs in engineering, management studies, architecture, law, arts, science, commerce, and polytechnic. Pharmacy College was established in 2007 by our visionary trustee, Shri B.L. Bulani ji. VESCOP offers BPharm and MPharm and PhD programs in various specializations. In a span of 14 years, VESCOP has prominently marked its presence in the field of pharmacy education and research by producing talented, well-rounded graduates and postgraduate students. Very recently, Dr. Harsha Katpalia has been awarded PhD degree of University of Mumbai, thus giving us the honor of producing our first doctorate student under Mumbai University. VESCOP received the Best Industry-Linked Institute Award in 2018 as per the prestigious AICTE CII survey. Till date, we have maintained platinum ranking in every cycle of survey. Our BPharm program is accredited by NBA and NAC peer team visit is soon expected. VESCOP has been consistently holding among top 75 positions at all India level from its 9th year of establishment in NIRF. VES had CSIRO status under the DSIR Government of India. Recently, VESCOP IIC Institutions Innovation Cell has received 4-star rating from Ministry of Education's Innovation Cell. We have already set up our pre-incubation center, and our incubation center in 7-storied standalone building is soon coming up. We wish to continue working harder with focus on research and innovation and creating a renowned research center at VS College of Pharmacy. I once again welcome all of you to our joint initiative. Thank you very much.
Thank you, Principal Madam, for that wonderful speech. Whenever I hear from you about our college, I feel very proud to be associated with VIVEKANAND Education Society College of Pharmacy. The said event is in collaboration with Department of Biophysics, University of Mumbai. I am happy to introduce Dr. Prabhakar Dongre, Professor and Head, Department of Biophysics, University of Mumbai. Dr. Prabhakar Dongre has completed BSc, MSc Biophysics, PhD Biophysics from Dr. Babasaheb Ambedkar Marathwada University, Aurangabad. Sir is a certified internal auditor, ISO 19002-2000. Sir has achieved a radiation safety officer license approved by Department of Atomic Energy, Government of India, Research and Development. Sir has pioneered work in the field of nanoparticle-based target drug delivery and nanostructure-based snake venom inhibitor. Sir has digitized several compounds of radio modifiers. Sir has also contributed in research and development, has published 75 research publications in peer-reviewed research journals. Sir has filed and published 6 Indian patents, reviewed of world top science research journals, successfully guided 8 PhD students, 2 postdoctorate students. Sir has also developed strong research collaborations with internationally reputed institute, IITB, ACTRAG, BARC, SPPU Pune, and Ashwamed Medicare Industry. Sir has also established a startup named Sinova Labs LLP. Sir is achieved and raised over 5.30 crore rupees through research and development project. Sir has received numerous awards: Best Academician and Researcher by Maharashtra Marathi Mandali, Mauritius; Best Research Paper Award by Biophysical Society of Japan in 2019; received Gold Medal for Research at Inter-University Research Competition 2019; Best Faculty of the Year under the category of Funded Research Project by the Computer Society of India, Mumbai chapter in 2019; Best Teacher Award by University of Mumbai in 2019. Sir is also a part of various scientific bodies, Vice President, Indian Biophysical Society from 2013 to 2018. Sir was also a member of International Union of Pure and Applied Biophysics, INSA 2012 to 2016. Sir is a president, International Society of Science and Technology, Mumbai, executive member of Society for Radiation Research, life member of Indian Biophysical Society. And with this brief introduction, sir, I request you to kindly come on the stage, use this platform and address the audience. Thank you, sir.
Good afternoon to all. Distinguished guest and participant of AZADIKA AMRUT MAHOTSAV, that lecture series organized by PES College of Pharmacy in association with the VIJNANA Bharati. The chief guest, Dr. Vandana Patravale, Professor by ICT Mumbai. Dr. Anudara Mujumdar is a dynamic and very enthusiastic and encouraging Dean of Science and Technology, University of Mumbai. Dr. Jayashree Fadnis, the Vice President of VIJNANA Bharati. Dr. Gulani sir, Trustee of PES College. Dr. Supriya Sidde, Principal of PES College. And participants, thank you very much for giving platform to the Biophysics Department on this occasion. So Biophysics is the unique discipline. I would say it is an emerging subject in the science, and it's very fortunate that the University of Mumbai established this subject in the academic year 2001 and 2002, and from this departments conducting academic programs in the areas of biophysics. In India, the MSc Biophysics program studies in a few universities like Punjab universities, Madras universities, Calcutta University, Delhi University, Osmania universities, EMGM Kottayam University, Dr. Babasaheb Ambedkar Marathwada University, Aurangabad. So there are a few universities having such a kind of as a training program. But however, as a PhD programs is well established in all national laboratories like CSR fund laboratories, ICMR, DE fund laboratories like TIFR, IISc Bangalore, NIRH, Mumbai, IIT, all IITs, all ICERs, NIV, and NCL. So this is the status of teaching training research program of the biophysics. But if you see, very few universities having MSc as a training program. However, some of the universities having specialized in biophysics subject, like for example, Pune University, they are having a specialized in physics as a biophysics subject. So actually, so let us see, it is a new subject. And what is the biophysics? If you open the book of physics, you will find the studies of atoms to the universe. The physics applies experimental approach to study the natural phenomena. If we open the book of chemistry, we will see the structure, function, and properties of chemical substances, chemical compounds to study the natural phenomena. If we open the book of biology, we will find the studies of living creature by observation and experimentation. But if you open the book of biophysics, it is difficult to guess what is in the book. So biophysics applies physics, chemistry to understand the biology. So biophysics applies mathematics or mathematical formulation to understand the biology. So ultimate goal of biophysics is to study the structure, function, and dynamics of biological system. So it is a quantitative understanding of biology. If you see the many of the branches like microbiology, botany, zoology, they learn biology. But approach of learning biology of biophysics is totally different. So it is a quantitative approach study. And many of the Indian scientists made a lot of contribution in the biophysics. Just Madam has told that C.V. Raman. Yes, C.V. Raman, lot of contributed in biophysics. Even Dr. G. N. Ramchandran from Madras, they contributed to biophysics. So many of the many of the Indian biophysics contributed in the area of biophysics. If you see in the Nobel laureate Ramakrishnan from Baroda University, he got Nobel laureate in the areas of medicine in I think 2009, and he's a biophysics and biophysics. So the University of Mumbai conduct MSc and PhD biophysics, MSc by the paper, MSc paper by choice based credit system, and first area of the research in the biophysics is the nanomedicine, nanobiophysics, radiation biophysics, and proteomics. The chief area covered under the course of the biophysics are cellular biophysics, radiation biophysics, molecular biophysics, medical biophysics, biophysics methods and advanced biophysical techniques, bioinformatics, molecular modeling and design, spectroscopy, biocrystallography, and recently we introduced the nanobiophysics, physiology biophysics, environment biophysics. So these are the most fundamental papers were studied in biophysics. The faculty members, including adjunct professors, visiting professors from top institutes like IITs, TIFR, BRC, even medical colleges, they play a crucial role in teaching, training, and research activities. The departments enable to create high-quality research laboratory for research and training with the software equipments like fluorescence spectrophotometer, fluorescence microscope, Fourier transform spectrometer, specifically we designed for the protein dynamics that in the introduction part, Dr. Vandana said that we had designed very special probe for study of liquid, special biofluid. So that is a very special probe design study the dynamics of the biological material. Also, we have a surface plasmon resonance analyzer, Raman spectrophotometer, dynamic light scattering, zeta potential analyzer, and EV spectrophotometer. Also, we have an automatic protein purification setup, 2D gel spectrophotometer with gel image analyzer, and recently we have installed a gamma radiation unit, and I'm sure, and this is a very unique. Again, we have installed this equipment under the DST per scheme, and I am sure this is again the equipment again open to all for colleges. We are giving facility to use this to all colleges affiliated to the Mumbai University. Department has received a financial support from various research, from various government grant like DA, BRNS, UGC, ICMR, DRDO, and also University of Mumbai to contribute for development department. I'm happy to say that the past student of the department pursue higher education at PhD and postdoc in international reputed institutes, laboratories, or universities. Few of them, like I tell that Kentucky universities, Max Planck, Germany, Hamburg University, Louisville, USA, Purdue University. These are some of the top universities. Students are pursuing PhD and postdoc. Similarly, many of the students were pursuing PhD and postdoc in ICERs, IITs, NCL, ICT, ACTRAC, BRC, or ISC. These are the placement of higher education. Similarly, past students have been placed in various pharmaceutical and biomedical industries in India and abroad. In the coming year, department is planning to expand a research laboratory with having mammalian culture and animal laboratory. To offer, also, we want to offer specialization in biophysics to specialize in biophysics at second year, MA second year. Also, we establish strong linkage again with industry and it's a laboratory across the globe. So with this, thank you very much for giving opportunity to talk on the few on biophysics. Thank you very much, madam. Thank you very much.
Thank you very much, sir, for sharing your expertise and prospects of biophysics. Now we move on to the most awaited session. Today's keynote address will be delivered by a well-known personality from academics, a very motivating and inspirational journey taking academicians to the next higher level, raising the standards of research in pharma academics. It gives me immense pleasure to introduce Dr. Vandana Patravale, Madam, Professor of Pharmaceutics, ICT, Mumbai, on this occasion. Dr. Vandana Patravale is currently a Professor of Pharmaceutics at the Institute of Chemical Technology, Mumbai. She has around 30 years of teaching and research experience. She has over 200 referred publications with over 9,000 citations with H index 48, I-10 118, 22 granted patents, 20 patents in pipeline, and 2 trade registries. She has published 2 books and 25 book chapters with international publishers. Madam has been active in teaching, research, and service throughout her career. She has recently been inducted as an independent director of a device manufacturing company and listed as top 2% of world scientists in pharmacy. Her areas of research include development of nanocarriers with major emphasis on infectious diseases, cancer, and neurodegenerative disorders, medical device development, nanodiagnostics, and nanovaccines. She was awarded Abdul Kalam Technology Innovation National Fellowship 2021, Fellowship of Indian Chemical Society 2020, Kukreja Oration Award 2020, APTI's Dr. Manjushri Pal Best Pharmaceutical Scientist Award 2019, Shri Amrut Modi Distinguished Researcher Award 2018, OPPI Women Scientist Award 2015, Bill Melinda Gates Grant Award 2015, Best Pharmaceutical Scientist Award 2014, Vasvik Award 2013, Veneto Nanotech Award 2013, APTI Best Teacher Award 2012, Fellowship of Maharashtra Academy of Sciences 2011 and 2013, and KH Garda Distinguished Researcher Award 2019. She is a Vice President, CRS Indian Chapter, Editorial Board Member, DTTR, Editor CRS IC and APTI Women Forum Newsletter. She is actively collaborating with researchers as well as industries within country and abroad and has completed Indo-Swiss, Indo-Japan, Indo-UK projects. She is executing all major grants from Indian government focusing on product development. She has transferred about 20 technologies to industry, including drug-eluting stents being marketed in more than 65 countries. Today, Dr. Vandana Patravale Madam will present her expert opinion on the Indian pharmaceutical research, reliving history, marching to the Atma Nirbhar Bharat. With this brief introduction, I request Madam to take over the platform and start with her presentation. Thank you, Madam.
Thank you for the kind words. And it is really a pleasure to be at this platform as a very proud Indian, where we are actually celebrating this lecture series under the aegis of AZADIKA AMRUT MAHOTSAV. Can someone tell me whether the screen is visible? My slides are visible?
Yes, ma'am.
Yeah. So thanks a lot once again. And thanks to Dr. Furness for giving me this opportunity to be here talking to you. And specifically, of course, to our own ICT alumni, Vijay Habu sir. So thank you once again, Dr. Furness from VIJNANA Bharati, KONKAN PRANT. Thanks to University of Mumbai Department of Biophysics, as well as the organizers, VIVEKANAND Education Societies, College of Pharmacy, Institute Innovation Council. So before I start, I would like to seek blessings of, Shri Bulani ji, who has contributed a lot towards education sector in India, as well as another living legend, my own father, Professor H.L. Bhalla. Both are 90 up and still contributing. What more motivation do I need to be in India as a proud Indian and to be speaking to you all future citizens of India who are going to make our nation proud? So, topic for today is Indian pharmaceutical research, reliving history, marching to Atma Nirbhar Bharat. So obviously, before I start, this is my institute. And the only purpose of putting this slide is now Institute of Chemical Technology is having 3 total campuses. One at Mumbai, that is in Matunga, which all of you must be aware. The second one at Bhubaneswar, Orissa. The third one at Jalna, Aurangabad. And this is the institute which has given 19 Padma awardees to the nation so far. So when we are working here, we are really working as proud ICTians. In words of Mark Twain, India is the cradle of human race, the birthplace of human speech, the mother of history, the grandmother of legend, and the great-grandmother of tradition. He further goes and says, our most valuable and most instructive materials in the history of man are treasured up in India only. So this is coming from an outsider. Do we have equal pride in things which our ancestors have given, and the torch which present generation, is carrying forward, be it scientists, be it economists, whatsoever? I suppose all of you know that the idea of zero, the decimal system, binary numbers, rural measurements, all of it has actually come from India. You must be aware that it's a Brahmagupta which gave us zero. Decimal system came 1200 to 1600 BC. Binary numbers given to us by Acharya Pingala, 2nd century BC. And of course, Sushrut, revered, at that time and till date, some of the practices which are followed in plastic surgery, cataract surgery have originated here in India. Ayurveda, of course, Dhanvantari, the Vedya to gods, they say. So from Vedic era, the Ayurveda is percolated down. And not to forget theory of atom, which was given by Acharya Kannada, also known as Acharya Kashyapa. It was 2,500 years before John Dalton's theory. The idea of giving these pictures, though they are not from pharma, is just to remind you that we have rich history, rich tradition, rich culture, and the torch of taking this further resides on your shoulders. Now look at, when was the Western science in India introduced? It began with establishment of some surveys which were taken, geological, botanical, trigonometric, all under the inspired impetus of Asiatic Society, which was inaugurated in 1784. And later on, establishment of universities in the port towns of Mumbai, then Bombay, Calcutta, and Madras in 1857. So this was a period which saw consolidation of British rule in India, especially with the failure of First Indian War of Independence, 1857. It is very important to remind you of history and then take you forward. British rule in our country was primarily based on their improved mode of production, as mentioned by Dr. Fadnes also. They improved technology, improved organizational abilities, everything. But for whom? It was for them. So, beginning of scientific research in India, as mentioned, was by Mahendralal Sarkar, 1876. And at the end of 19th century, India had total of 6 science-related societies. Some of you would have visited Asiatic Society of Bombay. It was set up in 1804. And 2 professional societies were Agricultural and Horticultural Society of India and the Bombay Natural History Society. And this slide depicts many of the familiar names which you would know, including Jagdish Chandra Bose to, of course, Dr. APJ Abdul Kalam. And in this slide, if you have to search for someone who is very close to pharmacy, you will see only one. So this is a slide depicting world-famous Indian scientists who have given newer dimension, newer meaning, have revolutionized world science, and you see only Praful Chandra Ray, chemist. Let's look at pharmacy profession in India pre-independence. The Western or so-called allopathic system came into India with the British traders, who later became the rulers, as we all know. And before 1940, almost all the drugs were imported from Europe. It's quite late that we started manufacturing in India. If you look at the pharmacy profession in India, the education part, it was marked by first class of chemists and druggists being conducted at Madras Medical College. And pharmacy education pattern was based on the instructions which came in from Great Britain. So we were the followers. Formal training of compounders started in 1881, and simultaneously the pharmacy profession entered India. For almost half a century, much of progress was seen until B.Pharm course started in Banaras Hindu University in 1937, and in 1944, the Punjab University, Lahore, now in Pakistan. So it originally was in Punjab, which later became part of Pakistan, Lahore. Indian Pharmaceutical Association, if you go to see, I'm sure all of you are familiar with this name. Many of you may be members of this, but do you know the history? It's Government of India. On 11th August 1930, they appointed a committee under the chairmanship of late Colonel Chopra to see into problems of pharmacy in India and then recommend what measures could be taken. You know, till then it was majorly the compounders which were trained, they were filling the gap between the doctor and the patient. And it is then Professor M.N. Shroff made an entry He initiated pharmaceutical education at Banaras Hindu University. And in 1935, we saw United Province Pharmaceutical Association, which later got converted into Indian Pharmaceutical Association. So if you have to look at the journey, in 1937, Government of India brought Import of Drugs Bill. It was withdrawn later. Government did not allow. Indian Journal of Pharmacy, started by Professor Prof, 1939. All India Pharmaceutical Congress Association, established in 1940. And again, government brought drugs bill so as to regulate the import, manufacturing, sale, distribution of drugs in India. Finally, I'm sure in your curriculum you are reading about this Drugs and Cosmetic Act of 1940 and the rules which went on modified later on. In 1941, first Drugs Technical Advisory Board was constituted. 1945, drug rules under this act came in. In the same year, government brought the pharmacy bill so that they could standardize the pharmacy education in India. And you know, PCI has been giving the norms since then. The Indian Pharmaceutical List was published in 1946, again under the chairmanship of Colonel Chopra. And this contains the list of drugs in use in India at that time, which were not included in BP. You know, as a student, I always thought, why is it that whatever was there in the British pharmacopoeia was seen in Indian pharmacopoeia, not realizing that had to be same at that time. It's only later that when we had the freedom, we could bring in newer and newer monographs. So, as mentioned earlier, B.Pharm course at BHU and Punjab started. BHU was industry oriented, whereas the Punjab one was more oriented towards pharmacy practice. And this, which was industry oriented, led to development of modern Indian pharmaceutical industry, which is now 4th in terms of volume and 14th in terms of value. This says it all. We really have grown. There have been periods of struggle, but just as Swami Vivekanand says, jitna kathin sangharsh hoga, jeet utni hi shandar hogi. And that's what happened with India. As I mentioned earlier, if we talk about one scientist who's been responsible for a major shift, it is respected Praful Chandra Ray, known also as father of chemistry in India. And if you look at his medals, decorations, or memberships, and how many honorary doctorates he has got, you would realize such a simple looking person, but had lot to his credentials. We are nothing. And this was in period when we were struggling to get freedom. So if they could do it then, why can't we do it now? Look at the title of this slide. Revolutionary in the garb of a scientist? Was Praful Chandra Ray a revolutionary? Answer is yes. He was a scientist as well as a revolutionary. Both ways it goes. He brought revolution in the science and also in the country. In 1892, he rented house at Calcutta and founded Bengal Chemical Works with a mere capital of 700 rupees, which if you see in today's date, of course, it is 3,000 US dollars or 230,000 rupees. He founded this company as an individual. So entrepreneurial entrepreneurship at that stage. He wanted to promote and foster the spirit of entrepreneurship among the Bengali youth and provide alternative to jobs than the jobs which were provided by British government. So of course he started in Bengal. Later on there were 2 more units. One of them is still there in Mumbai. Reputation of the company grew. Ray added additional funds of about 2 lakh, equivalent to about 6.1 crore in today's date, so as to increase the scale of production. So they started in a very small way, manufacturing alcohol, which was simple because it was coming from molasses. But even there was a need for that. And then did a lot of work in the herbal category. Of course, company went through ups and downs. Finally, government had to take it up. There were many name changes. Later on, it came to know as Bengal Chemicals and Pharmaceuticals. There were other companies like BK Paul and Company, Kolkata, and Powell and Company, Mumbai. All of them were traders at that time of point, wherein they were importing and distributing all these allopathic medicines. So they but started the zeal of patriotism. That is very important, so that they can compete. So initially, they got the products in, they studied the quality, then they started manufacturing the same quality products in India. So many years later also, when we talk about generics, what are we doing? We are doing the same. They have done it at that time. Now comes Second World War, which all of you would know that has caused severe scarcity of modern medicines in India. Period 1939 to 45. And at that point, microbial diseases created distress among people. And they became primary cause of death. And when I say this, I talk at every forum. Why is it that researchers here in India, most of them are spending time on looking at diseases which are lifestyle diseases like obesity? I mean, that is also important, I'm not saying. But why don't we talk about infectious diseases which are still prevalent? Malaria, tuberculosis, influenza, now COVID, everything bringing newer and newer challenges. So we need to put in efforts in that direction. So there were 3 countries, UK, Germany, and Switzerland, as Dr. Anuradha mentioned. They were very advanced at that time point. So there was a national crisis to develop policies and methods so that we could supply life-saving medicines at affordable price. Obviously, the pre-independence scenario was not exciting by any means. Britishers wouldn't allow us to do anything. So, though we had raw materials, we had manpower, we had the intellect. Talking about raw materials, what we had were largely inorganic. If you look at the organic raw materials, they were mostly coal tar based products. And petroleum based industries were in infancy. I'm very proud that Dr. Mukesh Ambani belongs to ICT again. Of course, his father was instrumental in starting Reliance, but he's taken it ahead. So need was that we work in all the directions, and whatever were the barriers which were existing, which were the hindrances in Indianization and industrialization, we overcome that. If I read about drug discovery, you'll be surprised that in our country, the beginning of drug discovery can be traced back to second decade of 20th century. There was work which was done by Upendranath Brahmachari in Calcutta on Kala Azar, also known as visceral leishmaniasis. And in fact, this particular college has given us many things. It led to urea stipamine, which was introduced in 1922. And this was designed, of course, for treatment of syphilis. After that, there were many antimonials which came, including sodium stibogluconate, meglumine antimoniate, which are still in WHO list of essential medicines. Though, of course, we can't say ORT, that's oral rehydration therapy. Immediately, electral comes in front of our eyes. It's electrolyte replenisher. But that concept also came in from India by H.N. Chatterjee, a medical practitioner who was working on cholera patients in Calcutta. So we cannot afford to forget small observations which lead to bigger things. And here I'm trying to make a point. When you're doing research, my dear students, observations are most critical. Do not neglect them. Moving further, Indian pharmaceutical industry evolved. So as I told you, pre-independence, hardly any industries existed. But the time of independence in 1947, India's pharmaceutical market was dominated by Western multinationals, and they controlled 80-90% of the market primarily through import. Approximately 99%, look at this value, 99% of all pharmaceutical products were under patent in India. They were held by foreign companies. So you can imagine the prices which our population had to pay for those drugs. And this is where people fought. In fact, we became signatory very late. Now the Hatch-Waxman Act came and we became signatory to GATT very late. And idea was that why should we make our own people devoid of medicines? Can we do something to ease their pain? And companies like Cipla really have fought tooth and nail for this. So when we talk about Cipla, one case study I'll represent of evolution of Cipla. See what Dr. K.A. Hamid had to say. Never again will India be starved of essential drugs. As I told you, because of the patent law which they were trying to bring in, India could not make any of the drugs which we required. We had to buy it from them at very, very high cost, which these people fought. So I'll take you in a systematic manner, talking about Khwaja Abdul Ali. So he was father of the picture which I showed you earlier, Dr. K.A. Hamid. So Khwaja Abdul Ali, he belonged to lineage of spiritual guides, Mughal emperors of India. Wife, Masood Jahan Begum, pro-British Amir of Afghanistan. But see how tables turn. Now, this Amir was assassinated. So family fled from Afghanistan to India. And therefore they became anti-British. So their ideology was anti-British. So he was lawyer by profession. So he gave whatever highest education he could give to K.A. Hamid. In fact, in many of his works, K.A. Hamid says and acknowledges that imparting moral and high values and positive attitude was from his father, which was a crucial aspect in his upbringing. In year 1913, when K.A. Hamid and family were living in Kanpur, a mosque near to their residence was partially demolished. And that was for widening of the road. So this, of course, led to agitation, where 70 people were killed. So this shook up K.A. Hamid totally. So he became very, very strong supporter of freedom movement. At that time, he was doing MSc in Munir Central College, Allahabad. And therefore, he actually joined the non-cooperation movement with Mahatma Gandhi ji, and Ali brothers came into force, focused on boycotting government as well as government-led institutions. So these are some pictures which I have taken from internet. And thanks to Dr. Fadnis that my knowledge actually has increased in this area. Inspired by the agitation and the strong anti-British sentiments, K.A. Hamid left Muslim boarding house of Allahabad. And along with many other students, he went to Aligarh. And you know that actually in Allahabad, he joined hands with Ali brothers and Mahatma Gandhi and formed a makeshift National Muslim University, which is present day Jamia Millia Islamia, one the very high ranking university. In fact, you know that Jamia Hamdard College of Pharmacy is ranking number 1. So there he worked as reader in chemistry. Then he went to Berlin, Germany to receive his PhD in chemistry and worked on technology of barium compounds. So if you talk about Dr. K.A. Hamid, yes, he did follow Mahatma Gandhi ji's Indian nationalism. K.A. Hamid's parents sent him actually to England, but so strong he was an anti, I would say, to British rule that he fled to Germany. He took the ship to Germany. And that's where he met a Jewish scientist whom he married. But they came back to Mumbai, India, when Nazis rose to power in Germany. And that's when Cipla was founded. Cipla, many may not know, stands for Chemical, Industrial and Pharmaceutical Labs. Founded in 1935 with the initial capital of rupees 2 lakhs. His eldest son, meaning Dr. K.A. Hamid's eldest son, Yusuf Hamid, he studied chemistry in England. And he is now chairman of Cipla. K.A. Hamid not only was instrumental in founding Cipla, he is the one who has conceived the idea of establishing NCLs and making it a reality. He is the one who has floated the idea and conceptualized CSIR. And you know what role NCL, which is also now coming under CSIR, what role they are playing. And during the last 4 decades of his life, he played very, very important role in raising Cipla to very high level. And if you go to Cipla, you can still see, many of such photographs where Sardar Vallabhbhai Patel ji, Sushila Nair, Shanti Swarup Bhatnagar, Ramswamy Mudaliar, Sri C.V. Raman, all have visited Cipla. And it used to be really pride visiting this particular company, which crossed in 1968 1 crore mark. And if you look at evolution of Cipla now, it has 1991 crossed 100 crore mark. Not only that, they are instrumental in many social activities. They founded the Palliative Care and Training Center in Pune. They've taken a lot of initiatives for understanding community needs. And of course, who doesn't know that Cipla is a world leader in anti-asthmatics? World leader now in many of the bioproducts, including trastuzumab, bevacizumab, rituximab, many. Not only that, anti-AIDS segment. You name and Cipla will have that particular medicine. In this COVID time, Were they behind? Answer is no. They received regulatory approval for launch of Ciplenza, which is favipiravir, to treat mild to moderate COVID-19. Also, I think in the diagnostic space, they were available. Remdesivir, of course, later on didn't do well, but Cipla launched even Remdesivir, which was a repurposed drug for this purpose. So yes, great place to work. It's taking India to world. And this name, no one can now forget. Y.K. Hamid. He's known as Grand Old Man of Indian Pharma. So just like I call my father Bhishma Pitama, meaning many people call Bhishma Pitama, even respected Bulani ji we talk. So same way, he's Bhishma Pitama of Indian pharmaceutical industry. And he always talks about his lifelong mission is to make drugs affordable. And there is need for incremental innovation. That is what he was advocating till the word disruptive innovation came. The second case studies from Alembic, touching lives over 100 years. Can you beat it? And the credit goes to Professor Tribhuvan Das Kalyan Das Gajjar. Now, Professor Gajjar, he was a very good chemist and was born in, of course, a well-to-do family in Surat. Did his studies in Mumbai, Elphinstone College. In fact, he taught also chemistry and physics to new students. But when the India's economic condition worsened during the British rule, he went back to Surat and started cottage industry school. His aim was to guide youth in various skilled work, which would be based in science so that they become self-reliant. So spirit of nationalism, prevailed all over. And you can see in 1900, in consultation with and with consent from Justice M.G. Ranade, all of you would have heard this name, and friends like M.G. Deshmukh, he became proprietor and director of Training Institute, which was named as Technochemical Lab, which was at Girgaon. And as I told you, later on, it took the name Alembic. So if you have to see now, this is a picture of Maharaja Sayajirao Gaikwad, Professor Kotibhaskar, Professor Gajjar, Rajmitra B.D. Amin, and Chirayu Amin. So, Rajmitra B.D. Amin, he was Vaidya to Maharajas. And coming together with these two friends, they created a history like nothing else. So if you have to look at Alembic's history, more than a century ago, the guidance and support of His Highness Maharaja Sayajirao Gaikwad, all of you know that MS University of Baroda, right? That is actually named after him, Maharaja Sayajirao Gaikwad. Great mind with business acumen. They conceived Alembic Chemical Works. Who are these people? Professor T.K. Gajjar, as I told you, Professor Koti Bhaskar, gold medalist, and Rajmitra B.D. Amin. This is a person, Rajmitra B.D. Amin, who had incomparable business tact. And that is very important. You may be a good scientist, but if you do not have business acumen, no technology will move forward. So either you have to have in you, or you have to really take people who have this in them. If you look at the lab, R&D lab, those era looked like this. And now if you visit R&D lab, which recently I visited, it is looking like this. Milestone which shaped their history. They started with manufacturing of tinctures and alcohol. And many of you would know that alcohol, is something which was getting manufactured in India. And for tincture, major constituent is alcohol. So you are extracting actives in alcohol to form tinctures. So they started a very small way. But then 1940, they started manufacturing cough syrups, vitamins, tonics. 1961, penicillin plant, which was actually inaugurated by Lal Bahadur Shastri ji. In 1967, vitamin B12. 71, erythromycin. I mean, they have many milestones, many firsts to their credit, including which for COVID, many of you would have been prescribed, either erythromycin or azithromycin. Moving further, they got their ISO certification. They started manufacturing now third generation antibiotics, including cephalosporins. And then they went in to take over oncology business of Dabur Pharma. 2010, if you see, their ANDAs total filed are 38. Drug master files 53, of which they've already got approval for 15. 2012, they launched dermatological division. And then in 2013, they launched first NDA coming from India. NDA is new drug application, which has to be filed in US. And obviously, there is no looking back. They formed a JV in Algeria, Alembic, Mami Spa, to explore African market also. Moving ahead, they are working on many moieties, including aripiprazole with Allure 60-40 ratio alliance. 2017, anti-cancer drug manufacturing plant inaugurated by Vijay Rupani ji. They acquired Audit Labs. So slowly they are acquiring some businesses, business houses, different countries also they are doing that so that they can have their own mark in those countries. 2020 now, if you see, starting with med tinctures and alcohols, they have reached $250 million US market. So now they have 9 manufacturing units, 10 plus therapy areas, 121 DMF filings, unheard of, 214 NDAs, which are generic drugs, 214. And of course, they started with 2 employees and now they are 12,000 plus employees. Third story of Zandu, which definitely is close to my heart because my dear husband worked with this company before he joined Aarti Group of Industry, which also started in a small way and now has become a 7,000 crore company. So talking about Zandu, if you look at evolution of Zandu, it starts with Vaidya Zandu Bhattji. In fact, he is the original founder. So he founded it in Gujarat. His real name was Karuna Shankar. And in fact, he used to prepare medicines for His Highness, the Jamsh Sahib. And those medicines used to be so very effective that His Highness allotted a piece of land to him, the banks of river Rangamati, so that he could formulate medicines. This factory was known as Rasashala. In fact, it still exists in Jamnagar if you go and see. Again, Vaidya Zandu Bhattji believed in philosophy. Neither do I desire for kingdom, nor heaven, nor nirvana. I desire that the diseases and miseries of all living beings are resolved. See, if you have mission in life, automatically universe will conspire to give you everything. I believe such mission exists in each one of us. If we look deep inside, we should give time for self-talk. And it is during these self-talks that I realized, though I was a university ranker, everyone was pushing me to go abroad for future studies. I said India has everything and I stayed back. So really proud Indian and proud India-bred scientist. Look at evolution of Zandu. Zandu, of course, took the name from Zandu Bhattji, took some of the preparation from Zandu Bhattji, as I showed you in the last slide, but it was Sri Jagatram Shankar Prasad Vaidya, who was again grandson of another, this particular Zandu Bhattji's Vaidya. I repeat, Sri Jagatram Shankar Prasad Vaidya's grandson of Ayurvedic visionary Sri Zandu Bhattji. So he had actually opportunity to acquire all the experience. But while he was studying, now progress has taken place. Now you look at earlier slide is his grandfather, right? So from grandfather to grandson, years have passed. Education has evolved. So when he was working with Professor Lee, and this also was in Rajkot, he realized that yes, herbal preparations can be made, but can we make quality herbal preparations? So this spirit he had, and with that he worked, and in October 1910 took birth of Zandu Pharmaceutical Works, wherein Jagatram Vaidya managed it. Now, as I mentioned earlier, any business needs a person with a business acumen. At that time, Sri Mathura Das Parekh was a business leader. He had all the skill set. He used to plan. He used to do the effective management for Zandu. So in fact, most of the success Zandu owes is to Mathura Das Parekh. And later on, if you'll see, Dr. K.M. Parekh, he had the vision. I'm sure many of our age group people will know Dr. K.M. Parekh. He used to be on all forums, all conferences, and he took Zandu, modernized it, took it to the next level, and then followed by his son, Ajay Parekh, and then Nihal Parekh. Another name which we should not forget is of Sri Gopal Das Parekh, who joined Zandu at a very young age in 1942. And when he visited Europe, he acquired knowledge and insights. Europe, was very rich history, again, like our India, in herbal products. So he then formed a team of his own to fabricate adaptations, import machinery from other Asian countries and other places, so that the drums which were used, if you visited Zandu, I have done as a student in 1982, I suppose, it used to be wooden drums for fermentation. So everything then went on to be a pharmaceutical standards where SS 316 steel is used. So he was really, really instrumental to give modern facilities to Zandu. Also, he standardized pills on these machines. So earlier, they were handmade pills, then they become machine-made pills for Gugulu. I'm sure all of you would have seen some of such pills which are coated with gold, coated with silver. So all these were now automated operations. So much so that in 1950s itself, they had treatment for many disorders, including arthritis, liver disorders, many other conditions, and then they started even exporting. So if you look at the important milestone for this company, Zandu Reality got established in 1910. This company went public in 1919, added allopathic medicines also to their product line. They started with Zandu chemical business. That's where my husband was actually associated. 1995, they set up new manufacturing unit at Piparia in Dadra and Nagar Haveli. You do get land benefits if you have your units in such places. They entered into joint venture with Gujarat Agro Industries, 1996. 98, 99 at Silvassa, they set up a new facility. 2004 to 5, two products of company. Who doesn't know Zandu Bab and Kesari Jeevan? They became super brands. The super brands, when you say not India, super brands, London. So can you imagine moving in a small way, the banks of river, having so many different manufacturing units and having brand image world over? The company really moved very, very fast. They had a unit even in Uttarakhand. And then later on, a turn took place wherein there was a merger of Imami and Zandu. And Imami bought all the stakes. Zandu bought back Zandu Chemicals, which was at that time valued at, say, about $170 million. And Nihal sold it at about $2,000 million. So that's how business moves. But Zandu all through worked with vision and mission. And that was to leverage the sphere of Ayurveda in the fields of pharmaceutical ecosystems, to attain diagnostic solutions, to produce and market Ayurvedic specialties which are cost effective, be high on quality, and of course ensure customer satisfaction. And they also encourage virtues of team spirit so that employees could learn, grow, and contribute to their own organization. So I think with this 3 case studies, I have given you enough impetus that one can start in a small way. What is required is only will, a goal in mind. Again, as Swami Vivekanand ji says, I cannot, he's one, if you read his books, you'll get all the motivation. People read Robin Sharma. I tell people first read Bhagavad Gita and read Swami Vivekananda. He says, उठो जागो और चलो जब तक लक्ष्य की पूर्ति ना हो जाए. But उठो. So we have to awaken ourselves first. So while this was happening, of course, Indian pharmaceutical industry, government policies were changing. So government policies culminated in variety of actions like the abolition of product patents on food, chemicals, drugs, and coming up with institution of process patents. Imagine if companies abroad have taken patents on a food item or a drug, you cannot straight away buy it. You have to buy it at a price at which they will offer you. So we needed to actually work around this, and people have really fought. Also, limitation of multinational equity share in India. So this was a very important move. This happened again in the area where I'm working, the devices area also. Devices sold by multinational companies, drug-eluting stents were sold at 2 lakhs, 3 lakhs. And they were directly sourced through doctors. And DPCO brought the price to, can you imagine what? 30,000 to 80,000. All multinational backed off. So India really is dominating in that region too. As also another policy, as I said, was imposition of price controls on certain formulations and bulk drugs. At that time, it was formulation and bulk drugs. Now, of course, devices too. So if you have to just read this chart, you will know that yes, started with PC Ray in 1901. Then we had Alembic 1903, small factory first in Mumbai, and then of course Baroda in 4 years' time. Zandu in 1910, Calcutta Chemical Company 1916, Bengal Immunity 1919, Cipla 1935, Amrutanjan Healthcare, Chennai 1935. We have East India Pharmaceutical Limited, Kolkata 1936, FTC 1940, 1941 Days Medical Stores, which started as a retail medical stores but then became a company. 1947 Indoco Remedies, and 1949 Ipca Labs, which some of you would know was owned by Amitabh Bachchan and Azitabh Bachchan, Jaya Bachchan, three of them. So later, of course, government took it. So of this, I have already discussed Acharya PC Rays, Bengal Chemicals, TK Gajjar's Alembic, and Zandu, which has given you some idea about how strong nationalists they were. That sense that we have to do something for our country, make in India, which again our Honorable Prime Minister is trying to do through various forums. So if you now look at Indian pharmaceutical industry, 8 of India's top 10 pharmaceutical firms based on sales were subsidiaries of MNCs. To facilitate independent supply of pharmaceutical products in the domestic market, Government of India founded 5 state-owned pharmaceutical companies. And now, India is world's 5th largest producer of bulk drugs. Of course, is it only the bulk drugs where we are excelling? We became self-sufficient in production of bulk drugs by having these companies. But India became self-sufficient in production of formulations also. So in fact, this slide gives you a trajectory of Indian pharmaceutical industry. Early years, market share domination was by foreign companies. No organized Indian companies. Phase 2, Indian Patent Act came into picture. Process patents, drug prices were capped. Local companies started to begin to make impact. 1980 onwards, it was a development phase. The processes got developed, production infrastructure, lot of infrastructure was created, export initiatives, many of them started. People were bold enough. You talk about Dr. Reddy's, Dr. Anji Reddy is also alumni of ICT. Talk about Cadila Pharma again. Mr. late I.A. Modi is also ICT alumnus. We really take pride in knowing these people. I personally interacted with Cadilla's I.A. Modi, sir. And their only mission was to provide cost-effective medicines, which are quality medicines, to our population. And then look at the globe. So a lot of export initiatives were taken. Many legal battles had to be won so that they could gain entry into US. I'm sure those of you who are pharma students and teachers would know that there is a way which is known as Para 4 filing. In Para 4 filing, you have to say that innovator who's already there in the market, I as a company am not using their process, using a different process. Or see that whatever they have given the patent is rubbish. Meaning you need to prove it. So the moment you do that and you tell US FDA that I'm filing by Para 4, immediately they will inform the innovator. An innovator would take you to law of court. Why? Because innovator gets 6 months exclusivity. And if you are now joining that league, you will get that 6-month exclusivity. So by dragging you to court of law, they are postponing your entry into the market. But if you're strong enough, they'll do settlement. And that's happening in industry today. And which could be billion-dollar settlement. Okay. So many companies really have taken those steps, moved ahead. Phase 4 is a growth phase where rapid expansion happened of the domestic market. But international market also grew for all these companies. And people now started pumping money in research. Still, if you look at, if other countries are putting in to the extent of 15 to 17% of GDP, we are just putting at 2 to 3%. But still, we are seeing a progress. And that model now will change totally, because our Indian government is bringing in and making all the efforts, let me tell you, to connect industries with academia and, of course, government. So it's a tripartite arrangement. And if required, NGOs also, they are roping it. So if that becomes a reality, no day is not far where there will be a very, very steep rise. And now we are becoming self-sufficient in biosimilars too. So newer innovations, newer research is the way forward, be it in drug discovery, be it in drug delivery, or biosimilars. So obviously, so far, bulk drugs, we were self-sufficient. Then we became again sufficient with respect to dosage forms. And now no one can beat us in that. Initial ones were like plant-based systems, certain balms, which were not patient-friendly. Now you've gone to emulsions and you've gone to nanosystems, which are so very friendly. All in all, turnover of product value for all formulations in 1948 was 100 million rupees. Okay, it rose to 1,264 billion US dollar, 20 billion in 2015. Can you imagine how many fold from million to billion? Commitment, of course, of the government for the development of whole spectra of pharmaceutical industry emerged out of compulsion and social commitments, so as to ensure that we decrease, basically foreign dependence. Advantage India, low cost of production. Economic driver, of course. Policies supported us. I'm sure many of you would not have read about Pharma Vision 2020. Read it if you have not. Now there is 2030 also coming. Increasing investment started happening in research and development. Acquisitions happened. Mergers happened. MNCs slowly are leaving India. And our companies, not only they are doing well in India, but they are capturing their markets also. So this is India's pharmaceutical market forecast. Consumers in India spend about 51.67% of their out-of-pocket health expenses on pharmaceuticals. India pharma sales to reach $33.18 billion by 2023. If you look at top 5 export countries, we are exporting to these countries, which is accounting for nearly 50% of our exports. Can you imagine? From importing, now we are reaching exports, and this value goes on increasing year by year. Of course, we are importing also from some, and that is a call which our government has now taken. If you talk about API turnover, India's API, that's active pharmaceutical ingredient market, this is also going to grow at cumulative annual growth rate of about 12%. And Katoch committee, they have played a very, very important role here. They have recommended that you create pharma cess zones. Like you have IT cess zones, create these parks. In fact, even the device company with which I am associated, they are getting now 100-acre land at Hyderabad, and they are building their device park. So that is because government is giving you subsidies and providing incentives to set up plants. So such a thing is happening in APIs also. If you talk about pharma, formulations cannot be complete without excipients. So global pharma excipient market is also on the rise. Again, 7% rise. So predicted growth is also nearly 6.43%. So that means at all different levels, we are growing. And if I have to list top 10 pharmaceutical companies in India, here they are with their turnovers. Of course, this is 2020 data. The Sun Pharma at the top. Sun Pharma, if you look at history of Sun Pharma also, Dilip Sangvi is a commerce graduate, but if you look at his father, he was in trading. So he started very small, trading of chemicals and pharmaceuticals. And to where Sun has reached now, Forbes magazine had this Dilip Sangvi's picture on it. That says it all. I talked about Cadila Pharma, with whom again I am associated as a consultant. They started, IMOD graduated from ICT, did work for some time in a company, maybe 1 or 2 years. He had a friend called Raman Bhai Patel, who started teaching at LMCP, LM College of Pharmacy in Ahmedabad. So both of them came together, and in a bungalow, in a room, they used to manufacture what is known as Heem Up. Today also that formulation is in the market. Wife used to clean the bottles, dry them. These people used to manufacture, fill it. She used to label them. IMOD sir himself used to go on bicycles selling from chemist to chemist. And from there, where they have reached now, I mean, you need to read the history. And of course, now you know that Cadila there are two Cadila. One is Cadila Pharma. IMOD's son, Dr. Rajiv Modi, is taking care of it. And we don't have Zydus Cadila, which belong to Raman Bhai, and his son, Dr. Pankaj, is taking care of it. So both have grown tremendously. And you can see Zydus Cadila also featuring here. Alchem story already I have told you. So yes, India is a global generics factory. We do have 22% of US FDA approved plants here in our country. Consistent growth happening in size and offerings. Generic medicines, 1 in 3 in US and 1 in 4 in UK is manufactured in India. I repeat, 1 in 3 of the generic medicine in US and 1 in 4 in UK is manufactured here in India. So this is one which is giving us 70% of the revenue. And you can look at the breakup later. 70% market share we have, as I told you. USV is slowly rising. So is Himalaya Drug Company. So you need to look at which companies are doing well besides the top 10 which I have shown you. So some of them are there in this list also, but there are many others which were not there in that top 10 but are rising very fast. So yes, India in the coming years, market will grow. I have told you it will become third largest in terms of volume, 13th largest in terms of value, and the way we are moving, we can become number one. And we will become number one, I must say, with all of you really learning pharmacy. See that your basics are very, very clear. These are some of the growing clusters in India. And you can see that by color, I've indicated where do you have R&D units, where do you have contract manufacturing units, where you have bulk drug manufacturing units, so on and so forth. So yes, we are doing quite well. Western region. Way forward, we need to look at our strengths, but not forget our weaknesses. Failures are very expensive. So we need to really evolve in terms of business models. We have to be resilient. We have to have discipline. One thing which you have to teach students is data integrity, no malpractices. Very, very important thing. And unless we do that, and coupled with disruptive innovation, which our chancellor, Professor Mashelkar, always says, let there be disruptive innovation. If that happens, obviously, we will harness the latest in science and we will move towards Atma Nirbhar Bharat. And by doing that, we would be providing access to healthcare as global citizens, healthcare which is affordable, easily accessible, acceptable, because you need to look at acceptability. Right now, we do not have any standards for pediatric acceptability. We are doing tests on adults and putting the drug formulations on market. So again, at ICT, we have established Pediatric Medicine Health Initiative, which actually was prompted by European Pediatric Medicine Healthcare Initiative, and where we are going to do research and look at how can we change the total look, the taste, quality of pediatric medicines as well as devices in India. So, historical evolution, the roles, responsibilities, and duties, we are shifting slowly from product-based roles to service-based, patient-centric roles. So, as scientific and technological advancements are taking place, economic, financial shifts are happening, there's evolution of the national health system, evolution of the model of care. Obviously, we can be service-based. So don't you think? Meaning, if you look at this, I always remember, what was our Ayurveda doing? It was always patient-centered. They used to look at the prakriti of the patient and then treat. We are moving back, going back to our traditional values. So yes, you dear pharmacists have a very, very important role to play. So be it with respect to making any of the medicines, quality medicines, be it the teachers who are supporting and educating, be it in research and innovation, or in distributing, supply chain is as important as manufacturing. Otherwise, the system collapses. And now it's emerging era of e-pharmacy. Again, competitions will increase. So are we equipped enough? You can see Asia Pacific definitely is the growing market. But we need to learn tricks and trade of this particular market to be on top. Pharmacists in e-pharmacy sector should be able to prepare e-health instruction, recognize the user needs, design e-healthcare solutions. In fact, many apps are there now. Many of our own graduates have come up with map apps which people can use. So if you put what are your symptoms, they will connect you to a doctor whom you should report to. You submit all your reports and the diagnosis would be given. So telemedicine in COVID era, I need not explain. You all have seen that we've not gone to hospitals, unless there's a dire need, and we've got all the support sitting at home. So obviously, we need to take up many roles which could be unconventional, like the ones which are given in the slide. It could be pharmacovigilance, which is on rise. Many duplicate things are coming into market. Now on capsules also, like you have on food items, a mark, band which can be scanned is coming. Because people are opening and filling things. You've seen what happened with remdesivir. Role of data analyst, very important. Our pharmacists are getting trained. And of course, there are many. Depending on what flair you have, you can choose anything. But most important is, can you start? Can you, under the Innovation Council, educate these graduates if they have to start And if they have a wonderful idea, provide them with all the support they want at no cost initially. I'm sure colleges will also prosper, because once these ideas they're taken ahead and reach industry, they get the benefits. These benefits, some percentage of it can come back into the same college. So government is promoting. There are so many different grants, which is itself a different lecture. And apart from that, there are opportunities in nuclear pharmacy, nutrition support pharmacy, forensic pharmacy, oncology, geriatric, pediatric, patient counseling. Many roles you as pharmacists have. But yes, do not forget, if you have the will, and even if you do not have the funding, your government is ready to support you. Prime Minister Ji said that there are 5 pillars of self-reliant India. Of course, economy, infrastructure, demography, demand, everything is there. But system has to be technology driven. Okay? So there are bold reforms which are happening, which is need of the hour also. So take benefit of these and see that we really make our country proud. And in this COVID times, when the import from China stopped, they really seriously felt there was a need to start manufacturing in this area. But people were not doing because there was no profit, right? There are many other things which could be done. So something which is available cheaply, take it from other countries and move ahead. But now we have realized that we can be self-reliant in that too. So in order to push local manufacturing, government has announced plans to localize manufacturing of 53 critical APIs. So a lot of meetings took place. They identified which 53 APIs we cannot depend on others. And then about 6,940 crore production-linked incentives were given. 3 mega drug parks were set up. And of course, government is also considering increasing the import duty on APIs. Currently, it is 10%. They are thinking of increasing so that it can boost local manufacturing. So I think with that, I'm coming to close of this. I've taken your time, but I thought it was very important to tell you where we were, how did we roll, we became so strong, and where we are. And from here, how we are moving very steadily and to be number one. So this is some of the research interests from our lab, and we are working in diverse areas, as you can see, and which is also indicated in this slide, which includes many of the drug delivery systems, the diagnosis. We are working on vaccines, which goes in the prophylaxis area. We are also making newer materials which can go into the delivery systems, and exploring potential of indigenous excipients, not to forget devices where we have the strong hold. And these are some of the technology platforms which our lab has, and many of the technologies, as shown earlier, have been actually given to industry. These are only some of them, and some are nano-based. You can see all of them are in the market. This is a vaccine in phase 3 studies. All these devices are in the market. So we work with this motto. I'm so happy that I'm talking, when Westcorp is an organizer, and we follow Swami Vivekananda's philosophy, which is take up one idea, make that idea your life, think of it, dream of it, live on that idea. Let the brain, muscles, nerves, every part of your body be full of that idea. Leave every other idea alone. This is the way to success. So in a nutshell, Swami Vivekananda ji said, have a goal and focus on that goal. Nothing comes in your way. So I'm thankful to our lab, and specifically to 2 people in the lab who have helped collect the data. Anjali Pandya, and Satyam Gupta. Finally, I would like to thank you all by quote from Dr. Kalam, who says, "You have to dream before your dreams can come true." Thank you. Thank you so much.
Thank you very much, ma'am, for your explicit presentation as always. May I now request Founder VS Trustee Shri Bulani ji to share his views and gives expert opinions on the talk delivered by Dr. Vandana Patravale. Over to you, sir.
Vandana ji, let me pay my gratitude to you for giving the history of development of pharma industry in India. Very rarely one can really do that type of job. Now, I belong to the age where I'm also celebrating 75 years of independence, because at the very young age, I participated in the Quit India movement, and I was taken to remand home for 1 month for protesting against the government, at the time British government, for putting our young person, Mr. Hemu Kalani, on the gallows. And I took the lead, and I was so popular in the whole of Karachi that my 6 schools remained closed during that time. And when I went to the remand home, I learned that there should be a national pride. British people, they should not take it that we are just slaves, or we are not so intelligent, or we are not capable of doing anything. Now, there was a simple demand to the superintendent of the remand home. She was lady, British lady, that we need at night a particular color for sleeping on the beds, because Karachi was known as a very popular city for the bugs, and those bugs, they were killing us at the night time. And we were children. I was hardly about 13 or 14 years old, and she refused. Now, the Mahatma Gandhi has said that whenever there is a resistance, don't do any violence, don't do anything which will not be respected by the others, but you can adopt a means which will be fair and which will make their conscience to come out. So I said, listen, if you are unable to provide, then permit me to go on hunger strike. She says, better you go on hunger, but I'll not permit you. I will not supply you. I came out, and I met the students. This is the type of things he is telling us. What is your comment on this? Shall we go on hunger strike? We are all children, 13 to 14. They say we will all go on hunger strike. So I went inside, told her, and when I told her that I will go on hunger strike, she took a cane and hit me. And when she hit me, it was all bleeding. I came out. All my colleagues, young children, they were crying, weeping. I said, don't worry. Only 12 of us will join the hunger strike. They said, no, we'll all go. I said, no. Only those who are strong mentally and physically, they will be going. And ultimately, it so happened that we went on the hunger strike. The message went to the local magistrate as per the British rules. And when he came to know that the children have gone on the hunger strike, he came running from the court to see us. And he invited madam to understand the matter. And then you see, he sent the matter, madam out and called me. He said, you are a young, handsome boy. Why you are not doing studies? And you are doing all this type of thing. I say, sir, I have a feeling for the nation and I have done it. I don't know. I'm still not at that your matured age to understand what is what and not. But I feel this is a good thing that I'm doing it. He said, okay, go out. He called that lady, rebuked him in English. I understood the English. I was studying English. And told her to go hug him, give him a glass of Mosambik juice with your hands and tell him that you are my son and I'll provide you everything that you want. And when she came out with the glass of Mosambik juice and hugged me, and she also cried, and I also cried. Then I told her that if I'm your son, then why did you not provide me? She has no answer. But she said, no, from today onwards, you are my son. You are a very good boy. What I say that if you have a national pride, and these type of activities, I have done it in Baroda, I have done it in the UK, London, Birmingham, where something happened and where I found that I'm right, I have done nothing wrong, and they have done wrong. I have gone on the hunger strike and I have been successful. So I will always say to anyone that you should be always on the right path and have patience. And second important thing is that when we came from Karachi as refugees, I was studying from engineering. I had to go to the Art Science Commerce College, started in Mumbai, Jahan College. And there, my idea was to start something in plastics, which my professor, who came from the Oxford University in 1945 to Karachi to teach us, he said, you have lived Stone Age, Iron Age, next is a plastic age. So I thought that is going to be from mechanical engineering, I'll go for the polymer engineering. And when I came here, there was no academy or college teaching subjects on polymer or plastic technology. Nothing like that. So I was all the time telling my chemistry professor at the college, sir, I need something on the plastic. Tell me which is the institution. I wrote to the BHU. They said, no, we have got all other technologies, but not the plastics. At that time, your institution was not started. It started sometime, I think, after 1952 or so. Now, you see, when I didn't get it, and my idea was to go into the plastics. Because what we are talking today, Atma Nirbhar, plastic was the latest industry in the globe. It was not the industry like pharma, which was started, say, long while. It is a post-war industry. And it was being developed in America and other places. It has been. But for the country like ours, where there's no education and there are no institutions who can guide you on that, What am I to do? And one of my professors told me that opposite Churchgate Station, there's a USA Information Library started in 1948, January, and you go and be the member. I say, I can't afford membership fees. He said, luckily, first 100 members are going to be free. You go there. I was a member number 6. Became the member. Went to the counter. The lady said, we don't have anything, any textbooks on plastics. Now the knowledge today of anything is available. In those days, knowledge was not available unless there are some institutions. So I will go daily. And one day she told me that you go to the chemistry section. Possibly you may get. And I found that there were encyclopedias on the plastics. It was Modern Plastics Encyclopedia, 1945, 46, 47. Now I began to look into that, and for 6 months, now naturally I was from the inter-science, so that I was not highly qualified to understand so many things of polymer science. But I sat down, studied thoroughly, and because my liking was for the engineering, so I went going into how the plastics are converted into the various products. And I found that there was a company in USA which was selling a machine for $25 and molds for $100 for small Ludo dices, this, that, some all small things. And those were started by Americans for their children as a hobby to be a self-reliant, what you call Atma Nirbhar. Backyard may you run the machine, learn, produce something. Sale, no, hobby. I thought, you see, this is the only thing one can do in India. In those days, the sources for the employment were 3 only: textile industry, and second was the railways, and third was the government service. All the craft industry are things which are made by hand. They were not in the urban areas, cities, what we call towns or cities. No. It was far away places and villages. Now you see, we as young people coming from the colleges, becoming graduates, no employment, government cannot pick up all the employees, not possible. My idea was, because I became, my subject was economics honors, and in which I read the history of economic development of each countries, including China. And I realized that unless we do something with our own hands and produce something innovative, at that time the word innovative was not coming to my mind, but today everybody talks of innovation. That is the innovation. That I must have some method whereby I should produce some machine or device to produce this type of plastics into the products. And that small machine gave the answer. Being a good in the engineering, I designed it, made it, and then when I made it, it came to me that I can do it. and I'll make a lot of money out of it. But the work has come to me in such a way that I alone cannot do it. One of my friends, he told me, Mr. Bulani, you are my neighbor in Karachi, you can become a millionaire. I have brought 10,000 gross of ball pens, refills. The ball pen shells you make it and supply to me. I say, I cannot do it. He says, go to UK, buy one automatic machine, bring it here. When I no, I want to do it here. So what I decided is better that I should become a mother industry. I made machines, I developed molds, technology. I was a regular member in the information library, I got so many ideas, and I went on inviting people to start the industry at home. In those days, the slogan from the government was save foreign exchange. They say save foreign exchange. Anything, if you import, we are losing foreign exchange. New country we under. And I can just tell you, I virtually created 10,000 small scale units throughout India right from 1950 till 1960. And that made a number of industrialists who were in the textile industries, and the textile industries was not doing very well. They went to the polymer industries. Mafatlal was one, then another big fellow in Ahmedabad. They were there. Likewise, so many people. Kilachand, the manufacturers of the our Fiat cars, they also went to that. And with one material coming here, within a period of next 10 decades, all the foreign machinery manufacturers came in India. They thought that there's a very big market. But the entrepreneurship was created by me in the people, and my company became the one-stop shop for giving them any information. Though I was not qualified in plastics education, but I worked hard. I went on collecting information from foreign countries, writing them letters, inviting them their literatures and everything. So this is what the type of things we have. Now we have come at the era of 75 years of independence. So I thought, okay, what we did it as initiators, similar thing is being done by way of announcing Atma Nirbhar Bharat. And we must have a national pride. These are the two very important things which must go through all the educational centers. And one of the main things that which I go on repeating for the last 10 years is that science and technology have to work together. And it is only possible that if we apply our innovative minds, how to use science and make it better useful by using technology. And on this respect, let me tell you, this college, under the leadership of Madam Sidhay, is doing wonders. And we always look forward that you should give your courtesy visits to us every 3 or 4 months. I will be highly pleased. Thank you very much.
Thank you so much. I mean, it was so inspiring listening to you, and I could really very well connect with you because these are some of the stories which I've also heard from, not stories, actually, the real incidences which have happened from my own father. And again, as you said, he was also 13, 14 when he went to jail. And he said that, being a child, he was given milk but others were not given. So, like a child, he could request more. So he used to request, collect everything, and give small volumes to everyone. I mean, that is something which is there in that generation, and there's so much to learn from them. So, thank you so much, and very rightly said. This is the exact Atma Nirbhar Bharat. So, just as I say, the life goes a full circle. So, we started from there. We are again going back, and we are quite sure.
That is my point.
Absolutely. Absolutely. So very, very sure that again the name which people used to call us by, Sone ki chidiya, will again be Sone ki chidiya. Yes. Thank you, and keep blessing us. And I would surely visit Westcop. In fact, twice, thrice we did plan.
Because the way you have given the information and the history, it has inspired me. And therefore, I suggested, not as an elderly person, but a person having passion for the research to be a regular visitor to us. Because then you will be inspiring all our teaching staff and the students also.
Sure, I'll do the needful, sir. Thank you so much. Keep blessing.
Thank you, sir, for sharing your experience. It is always a pleasure to listen to you. Now, I request my colleague, Mrs. Pradnya Korlekar, to take it over.
Hello, audience. So, on this occasion, we have one special announcement to be made by our principal madam. We had conducted national level e-poster competition. Was I visible? Yes. We have conducted a national level e-poster competition, which was organized by IIC Westcop in collaboration with Department of Biophysics, University of Mumbai, under the aegis of University of Mumbai, for celebrating AZADIKA AMRUT MAHOTSAV. The topics were contribution of scientists or stalwarts of Indian pharmaceutical industry to shape the future of India post-independence, and second topic was digitalization in pharmacy. I am very happy to share we got an overwhelming response, and we received over 257 posters, and over 300 students participated in the competition, and it was across the nation from various states. I would request Professor Supriya Shide Madam, Principal Westcop, to announce the names of the winners.
So the first prize is won by Amok Bhanushali Sweetie Chedda from Dr. Bhanuben Nanavati College of Pharmacy. Hearty congratulations to you, Amok and Sweetie. Second prize is won by Archit Kadu, Akanksha Somant, and Upasana Chandramohan from Vivekanand Education Society's College of Pharmacy. Congratulations, Archit, Akanksha, Upasana. And the third prize goes to Animesh Kumar Singh from NCRD's Sterling Institute of Pharmacy. So hearty congratulations to Animesh and Sterling Institute of Pharmacy. And then there is one more prize that is shared. Third prize is shared by one more group, Samiksha Mestri and Vaishnavi Sathe and Komal Chandra from Vivekanand Education Society's College of Pharmacy. Congratulations to Team Westcop winning third prize. Thank you.
Thank you, madam. Thank you so very much. Congratulations to the winners, and I appreciate on behalf of Westcop all the participants who enthusiastically participated. So now going to the last segment of the session, vote of thanks. Honorable Dean Madam, respected Principal Professor Supriya Shidhe Madam, distinguished speakers, all the staff members and most valued delegates, and Dongre Sir, I feel honored and privileged to propose vote of thanks on this occasion. I present this vote of thanks on behalf of VES College of Pharmacy and my co-coordinator Dr. Aparna Palshetkar and team IIC of WESCOP. I would like to thank our trustee Shri B.L. Bulani ji and Professor Jannadas Madam for their constant motivation given to us. I sincerely express my gratitude towards Principal Madam, who is a perfect guiding force and a true leader for all of us. I must say that because of her, we could make this program happen in the presence of such an eminent personalities in the field of education and research. I am extremely thankful to all the dignitaries. I express my gratitude to our today's keynote speaker, Dr. Vandana Patravale, Professor of Pharmaceutics, ICT, Mumbai, for her explicit presentation. Dr. Anuradha Mujumdar, Dean, Faculty Science and Technology, University of Mumbai. Dr. Madhav Rajwade, who has guided the session. Dr. Rajashri Fadnis Madam, Secretary, Vidnyan, Bharati, KONKAN, PRANT. Dr. Prabhakar Dongare, Professor and Head of the Department of Biophysics, University of Mumbai, for squeezing out time out of their busy schedule and sharing their knowledge with all of us present here. We have been fortunate enough to be backed by a team of a very proactive and dedicated staff of our institution. I express my thanks to AZADIKA AMRUT MAHOTSAV team members, Dr. Chaitali, Dr. Neha, Dr. Aparna, Dr. Avinash Suryavanshi. And I also thank Team IIC for backing us. This program went smoothly because of dedicated efforts by ICT committee, successfully handled by my colleagues Mrs. Prachiti Aire and Dr. Anand Chintakrendi. Success of the seminar depends upon the participating delegates. I wish to express my deepest sense of appreciation to all the delegates. We have overall 307 registrations across the nation. I also thank to those whom I might have forgotten to mention. Lastly, I would like to thank the Almighty for making this event a grand success. Thank you very much. Here I declare that we conclude the session. For more updates on upcoming webinars and workshops, please subscribe to our YouTube channel. We are also there on LinkedIn, Facebook, Instagram, and Twitter. Thank you.